No one could have predicted in the early days of 2020 that a global pandemic was just around the corner. While our pharmacy retailer clients had to pivot quickly to ensure the health and safety of their staff, patients, and customers, Pear pivoted quickly too, with the launch of Pear versus the Pandemic. Under this brand, we developed complimentary, pharmacist-authored, peer-reviewed articles, and fireside chat webinars that offered practical information on topics related to practicing pharmacy amidst a pandemic. Now, instead of me telling you about Pear, we spoke with some friends of Pear, all pharmacists and leaders in their respective communities, to collect their thoughts on the impact Pear has made in their pharmacy community.
Thank goodness for Pear. Partnering with the Pear team meant I no longer needed to spend months planning and coordinating. No more long days and sleepless nights hoping we would be ready in time to educate over 500 pharmacists in a central location. Pear truly were a full-service agency. They took care of everything: content development, accreditation, and delivery. Pear are known for their expertise in pharmacist education. However, they did not hesitate to accept the challenge of procuring education for our opticians as well, and they did not disappoint.
Rita, given your deep understanding of the current pharmacy landscape, why should retailers and pharmaceutical companies work with Pear Healthcare Solutions?
Thanks, Dawn. That's a really good one. Pear has been a constant for pharmacy. You and your team are very creative, and during COVID, you have shown that you're a nimble team, very responsive to your clients and the industry's needs. Pear has been able to deliver quality content that is timely and so relevant given the changing pharmacy and healthcare environments with current events today. Your team does listen and is laser focused on delivering exactly what the customer wants, on time, with great quality and no stress. I wouldn't hesitate to recommend Pear to anyone in our industry to help their business find solutions to any of their pharmacy needs.
This year has brought new challenges to the profession. When physicians and clinics closed their doors, pharmacy teams were there to meet the healthcare needs of Canadians and fill the resulting care gaps. Frontline pharmacists continue to play a crucial role in essential public health measures by administering flu shots and other vaccines, and in some cases performing COVID-19 testing. Let's hear what some friends of Pear have to say about working with us to support pharmacy teams. Zubin, as a leader in the academic pharmacy community, what are your first-hand impressions of Pear's team and our work?
Happy to share my thoughts, Rose. All professionals need to stay up to date, but it can be really difficult to find and access the high-quality continuing professional development we all need to keep current in our field. Pear makes CPD easy, accessible, and enjoyable. They work with subject matter experts like me to curate and design interactive CE that practitioners find engaging, useful, and relevant to daily practice.
Thanks for sharing those impressions, Zubin. Any comments on why the work that we do to support continuing professional development is important?
Absolutely, Rose. I could never develop and deliver this kind of high-quality learning on my own. Working with the team at Pear, I have learned so much about instructional design and technology in a way that actually matters for frontline healthcare professionals, so that they can help their patients.
SHERILYN, you have collaborated with our team on a variety of projects. As an academic and practitioner in travel medicine, how do you feel that your work with Pear in continuing education helps to enhance the care delivered on the front lines and subsequently patient outcomes?
Thanks, Rose, for this question. It raises the very important point that the ultimate goal of any continuing education program is an improvement in patient outcomes. We have really strong evidence that shows that when pharmacists practice to their full scope and apply evidence-based medicine, that patient care outcomes are improved. The challenge really is that there's constantly evolving medical literature, and it can be very difficult to stay on top of it, especially for frontline practitioners who are also juggling full-time patient care responsibilities. So I think this is where Pear really excels. You partner with academics like myself or other expert practitioners to develop programs that can translate this medical literature into practice-ready applications. And with the end goal of patient care always in mind, I think pharmacists can have confidence that Pear's programs will be timely, relevant, and practical for them. So equipped with not only new knowledge, but also strategies to apply that knowledge into practice, pharmacists really will be well prepared to provide the most evidence-based care possible, which we know will result in improved patient outcomes.